This is the early healing phase, and by day 3, swelling begins to subside and any soreness fades. So you're considering getting an ARTAS robotic hair transplant. Or perhaps you've already decided on getting one, but you want to know what the recovery process looks like. How long until you can go back to work? Or when will the redness fade? And when will you start seeing new regrowth? Now in this video, we'll walk you through the entire ARTAS recovery process day by day, so you know exactly what to expect from the moment you finish the procedure to the moment your new hair starts growing. I'm Dr. Vic Khanna. I'm a board-certified dermatologist with over 25 years of experience here in the Chicago area. Our team specializes in robotic hair transplantation utilizing the ARTAS system. Our patients choose ARTAS because it offers precision, faster healing, and natural-looking results with no linear scars. Recovery with ARTAS is typically smooth and comfortable, but knowing what to expect each day helps you feel confident and prepared throughout the process. Now, on the day of the procedure, Day 0, your procedure is complete and you're heading home. Here's what happens that same day. Your scalp may feel slightly tight or tender, but discomfort is usually minimal and usually managed with over-the-counter pain medication. Small red dots will be visible in both the donor area at the back of your head and in the recipient area where the grafts were placed. We'll give you detailed aftercare instructions, including how to sleep elevated, avoid touching or scratching the area, and how to keep the area clean. This is an outpatient procedure, so you'll be able to go home right after your operation. Day 1 and 2. Now, that's the time for rest and recovery. The first couple days are all about rest and protection. You may notice mild swelling around the forehead or temples, and that's completely normal, and it's temporary. Tiny crusts or scabs may form around each transplanted hair follicle. We want you to avoid direct sunlight, excessive sweating, and exercise, at least for now. We're going to have you continue using the saline spray that we provide to you to keep the grafts very hydrated. We'll have you sleep in an elevated position, and most patients describe this stage as slightly sore but very manageable. On day 3 to 5, this is the early healing phase, and by day 3, swelling begins to subside and any soreness fades. The small red dots and scabs begin to dry a little bit and darken, and you can gently rinse your scalp, but no scrubbing or any pressure on the follicles yet. The donor area where the hair was extracted may feel a little tight, but that's going to heal very quickly. It's important not to pick or scratch at the grafts at all. They're still trying to anchor securely into the scalp. On days 6 to 7, and that's pretty much back to normal activities. By the end of the first week, the grafts are firmly in place. The scabs may naturally flake off as you wash very gently, and redness is beginning to fade, especially for the lighter skin-colored patients. You can usually return to work and light activities if your job doesn't involve heavy sweating or dirt exposure. Between day 8 and 14, there's visible healing and mild shedding. During the second week, the scalp continues to improve visibly. The redness and scabbing are nearly gone, and the transplanted hairs begin to shed. Now, this is entirely normal and expected. Donor sites are nearly invisible, even with the shortest hairstyles. Shedding at this stage doesn't mean the grafts have failed. This is a normal part of the hair growth cycle and the transplantation process. Your follicles are alive under the surface and will soon start producing new hairs. Weeks 3 to 4 are the resting phase. So after the shedding phase, things get quiet for a month or so, and that's again to be expected. Your scalp looks smooth, healed, and back to normal. You can resume all your normal activities, your workouts, your haircuts. The transplanted follicles enter a resting phase called telogen, and they're preparing to grow new hair in a few months. At this point, you might feel like nothing's happening, but your follicles are busy building the new roots under the surface. Months 2 and 3, the early growth begins, and this is when you might start to notice small, fine hairs emerging from the transplanted area. They'll be thin at first, similar to baby hairs, but this is your first sign of new growth. It's also normal to see some temporary shedding of native hair. We call that shock loss, and it's especially around the transplant sites. Now, this is temporary and it'll recover as the growth continues. In month 4 to 6, we see noticeable change. Now, this is where the most exciting stage begins. This is where you're going to see the thicker, denser hair starting to fill in the previously thinned areas. Now, the growth accelerates and the texture begins to match your natural hair. By month 6, most patients see around 50 to 60% of their final results. And your hairline will start to take shape and look more natural every single week. Now, months 6 to 12, we have full maturation. Between months 6 and 12, your hair continues to thicken, darken, and blend seamlessly with the rest of your scalp. By month 12, you'll see your final results, a fuller, permanent head of natural hair. True final results can sometimes take more than 12 months, but typically around the 12-month mark is where you'll see where your new hairline will be, and you'll see what your new head of hair will look like. Now, how do you support recovery? Here's how to ensure the best outcomes. Follow all of the post-operative instructions closely. Treat your grafts very delicately. Also, avoid smoking and heavy drinking during the first few weeks. We want you to stay hydrated, rest well, and eat a nutrient-rich diet for optimal healing. Protect your scalp from sun exposure for the first month and avoid harsh chemical treatments until cleared by your provider. Our team at DSI is always available to answer questions and guide you through every step of the hair transplantation process. Recovery after an ARTAS hair transplant is smoother than most patients expect. The key is patience, proper care, and understanding the timeline, because real, lasting, permanent results take time. If you found this video helpful, make sure to like, subscribe, and schedule your consultation at DSI Hair Restoration to learn more about whether an ARTAS hair transplant is right for you. We'll see you in the next video.